Introduction to this course. Welcome to the online toolkit for laypersons to learn motivational interviewing for tobacco cessation. I'm your instructor, Nicholas Cohen. I'll begin with an introduction to who I am. Then I'll provide a background and rationale for why this toolkit was created. Next, I'll describe this course, outline the goals, and provide you with a schedule of topics, readings, and assignments, as well as the grading system. Let's begin. I'm a family physician in Cleveland, Ohio. I am the program director for an AmeriCorps program where we train layperson volunteers, AmeriCorps service members who spend a year with us. I'm a certified trainer in motivational interviewing, and I'm certified as a tobacco cessation treatment specialist by the Mayo Clinic. Background. Tobacco use is the leading cause of preventable death in the United States. Nearly 500,000 people die from tobacco use or secondhand smoke every year. And that's almost 1 in every 5 deaths can be attributed to smoking. Indeed, smokers die 10 years earlier than non-smokers. And tobacco use in Cleveland happens to be more than double the national average. Here's a slide demonstrating the comparison between Cleveland, Ohio overall, and in comparison to the United States. Why are rates so high in Cleveland? That's where I practice as a family physician. Is it that smokers do not want to quit? The answer must be no, because nearly 7 out of 10 smokers report wanting to quit. Are the rates so high because people can't afford to see a doctor? Again, the answer must be no. Ohio ranks 14th of states in terms of health insurance coverage. It has one of the lowest uninsured rates in the country. Here's a map illustrating and comparing states across the country with regard to the rate of uninsured adults. Ohio is in light blue, indicating that it's has one of the lowest rates of uninsured adults. So why are rates so high? Is it that we don't have effective treatments for smokers? Again, the answer must be no. We do have effective treatments. Motivational interviewing increases a person's chances of quitting smoking by 26%. A single nicotine replacement therapy, such as the patch, the gum, the lozenge, the nasal spray, or the inhaler, or bupropion, also called Zyban, double the quit rate. And combining nicotine replacement therapy, such as the patch and the gum, or the patch and a lozenge, or using varenicline, also known as Chantix, triples quit rates. So why then is tobacco use in Cleveland so high? Well, one thing we know for sure is that smokers who see their doctor are not receiving the interventions that we know work. For Ohioans on Medicaid, 5% receive medication to help them quit, and only 3% receive counseling. Why then don't doctors offer medications and counseling? Well, providers nationally cite time constraints. We have 15 minutes to see each patient, and tobacco cessation counseling and planning a helpful quit attempt are time-consuming. Often a team-based approach is recommended to overcome a provider's constraints, where other lay people or other clinic members assist patients with quitting smoking. But Ohio ranks 45th in the nation in terms of public funding, the kind of funding that could assist clinicians in delivering tobacco cessation interventions. Here's a map showing in dark blue where Ohio stands compared to the rest of the nation with regards to annual spending on public health. And that brings us to the rationale for the program we've created in Cleveland, Ohio.